day, dear colleagues. I'm really happy to be here. That is why I have only 10 minutes. I'll try to share you faster with our results. As Alexander Popov said, we are not BM but BFM oriented, so I want to share with our cooperative results in our center with the different Russian clinics. So we all know that on the first place among children types of children cancer, there are leukemias and central nervous system tumors. It's a well-known fact. So here is some already published data. According to we can see that the results of first diagnosed active lymphoblastic leukemia results are really dramatic, and there are actually have a good results. That's data already published, and evolution of active lymphoblastic leukemia therapy. First diagnosed active lymphoblastic leukemia started from temporary remission induced by aminopterin, and then was created risk-adapted therapy programs. And with the evolution of supportive care, the results become really better than it was. And from 2005, medial residual disease (MRD) started to be a main strategic action factor for prognostic risk groups, especially on BFM-oriented program therapy. So that's also a well-known diagram. I suppose some of our colleagues already showed it today. So the basis of successful active lymphoblastic leukemia treatment, first diagnosed active lymphoblastic leukemia, is strictly following the therapy protocol. And nowadays, according to clinical recommendation of our Ministry of Health in Russia, there we can use two therapeutic protocols. The first of all is BFM 2002 and Moscow Berlin protocol 2008. And results were already shown in this audience. Here is short data about the previous, not the last one, World Health Organization, about divided of leukemia nowadays, village and T lineage, and some of the genetic mutation that can impact on prognosis nowadays with the first diagnosed active lymphoblastic leukemia. So here is the entire classification of active lymphoblastic leukemia CBFM 2002 protocol. It's well known. Traditionally, it was based on 3 control points on day 8, day 15, and day 33. Was no MRD measurement, only blood smear, only morphology and cytology remission. And that is why it was divided 3 risk groups: standard, integrated, and high risk group. So here entire protocol and already published results. We can say that is actually not bad. Overall survival in 2002 protocol was more than 19%. Here is our single center experience, and here is some characteristics of patient. The number was 125. Majority of patients had common immunophenotype and was standard or intermediate risk group. And here is survival outcomes from our Plaquemine National Research Center. Overall survival over the entire group was more than 19%, with median follow-up 10 years. And event-free survival 89.5%, which actually is similar to worldwide published investigations. We traditionally are participant of the entire BFM world group, and it started from 2003, and since 2010 we are a participant of the BFM 2009 protocol. It was already included 137 patients, and stratification, as I mentioned, is based on the results of minimal residual disease. So in 20 July was organized the Russian BFM group, And 1 year later, we organized the first meeting of the participants. We organized a discussion platform for scientists, researchers, and physicians working in the BFM protocol to discuss some problems of treatment of lymphoblastic leukemia and lymphomas also. So here is the characteristic of patient included in the whole study among Russian center participated of BFM Russian group. The number of patients is more than 400. So we published, of course, our data in Russian journals. You can see the results. The overall survival of entire group were 93%. And event-free survival more than 80%. So, of course, we have some problem to discuss. We need to improve the quality of medical information. For example, we need to form a follow-up group for our patient among our hospitals to participating in our study. And also we sometimes have a referral investigation for eschatologic blood smears that done in other clinics of our huge country. So here are the results of multi-center experience of ALIC BFM 2002. We already published it even in Russian journals, of course, and was included 433 patients in B and T lineage leukemia also. And you can see that the results of overall survival patients with the T lineage leukemia are also not so bad as we expected. Is about 80% of entire group, and overall survival of whole group of patients is more than 90%. Depending on risk group, of course, result is less in high risk group. Of course, it's we expected that. So in high group of patients, overall survival was 71, and for event-free survival only 63%, and it's one of the questions for discussion because we can improve this result using, for example, transplantation technologies in first remission if they have match-related donor for this patient. Here is the list of our participants. I should apologize because we decided to not to write it in English to avoid some mistakes. Yes, here is 14 centers and 2 centers from Azerbaijan. Here is a classification of BFM 2009 based on MRD level determination on day 15, of course. And here the entire scheme of treatment is similar to the latest one, as I mentioned. So there is some question that we suppose is important for the future protocols. For example, one of them is determination of minimal residual disease at later stage of therapy. Is it needed? Is it going to improve survival of our patient? It's one of the questions that BFM group now is discussed really active, and also the using of new drugs, targeted therapy, immunotherapy, Yerevan in first line, for example, for T lineage, acute lymphoblastic leukemia, and Batmanova in first line, also for B lineage. So I think I don't spend a lot of your time for conclusions. You can see all of them. So here is our big, really huge team of our center. I want to say thank all of them. Yes, so 1 minute. Thank you all, because I think we are doing a great job together. Thank you for your attention.